Hey, good morning, everybody. And thank you for joining us today to discuss what's one of the biggest and most urgent issues facing Arizonans right now. That's combating COVID-19. I think it's important that before we start this conversation, we take a moment to recognize the hard work and the sacrifice of our county public health officials, the administrators, and staff in hospitals and long-term care facilities, and all of our healthcare workers, especially frontline workers, nurses that are on the front line of this crisis. And they've been on the front lines under very difficult circumstances, providing the quality care to folks who need it all across our state. So we are extremely thankful for the work that healthcare workers and hospital staffs are doing in treating Arizonans and fighting this virus. I want to start by welcoming to this discussion several members of my transition team and distinguished Arizona leaders from across the state. I appreciate all of you taking part in what I know is going to be an important conversation. I mean, we've got a serious public health crisis, and it's worsening, and an economic crisis. And both of these things have been made worse by a crisis of leadership. Throughout this campaign, I had the opportunity to speak with a lot of Arizonans, and everyone seemed to agree on one thing. And that's that Washington has not been working for Arizona. Now more than ever, we need our leaders in Washington to focus on addressing this crisis. This has been a challenging time, especially for those who have lost a loved one or lost a job or are struggling to keep their businesses afloat. I've spoken with folks who have faced the impossible choice between, paying for rent or putting food on the table or filling a prescription. I mean, all because of a dysfunction and often also indifference in our nation's capital. We've got 440,000 Arizonans who are trying to get by on about $240 a week in unemployment benefits. That does not work for anybody. The math on that does not work. And it's time we change that. So I look forward to working in a bipartisan way to combat this public health and economic crisis and make sure that communities across the state have the resources that they need to make it through this pandemic. Now, I've been looking forward to this, so let's get started with our conversation. We'll have our panelists first introduce themselves. Dr. Gerald, could you please, start off by introducing yourself and sharing a little bit about your background, and then we'll go through everybody. I think we got the order, sort of figured out. If that becomes an issue, I'll moderate here as we do the introductions.
Right. Thank you, Senator-elect Kelly. I'm honored to be here today. My name is Dr. Joe Gerald. I'm an associate professor at the University of Arizona Melanita Zuckerman College of Public Health, and have been very engaged in monitoring the state's coronavirus outbreak since March, and prepare a weekly report outlining the various important metrics, case counts, hospitalizations, deaths, and that type of thing. And I'm also a team member for a collaboration between the University of Arizona, Arizona State University, and the Arizona Department of Health Services to model and create forecasts for the outbreak for the state of Arizona and local jurisdictions. Thank you.
Why don't we go over to Anne Marie?
Thank you. Thank you for having me this morning. My name is Anne Marie Alameddine. I'm president and CEO of the Arizona Hospital and Healthcare Association. We're a statewide hospital association with over 70 hospital members. And we also have a number of programs, most notably today for this conversation. We administer the Department of Health Services, Arizona Coalition for Healthcare Emergency Response. So we're engaged with emergency managers and hospitals and healthcare providers across the state, trying to coordinate emergency response, get supplies where needed, and other efforts. So thank you so much for having me here today.
Thank you. Mayor Evans.
Hello, Senator-elect. Thank you for having me here today. My name is Coral Evans. I am the mayor of the city of Flagstaff, Arizona. I am the vice chair of the Greater Arizona Mayors Association and a small business owner. I look forward to the conversation.
And Neil Giuliano.
Thank you, Senator-elect. Congratulations. It's nice to see everyone. I'm Neil Giuliano with Greater Phoenix Leadership, President and CEO of that CEO consortium here in the metropolitan Phoenix area, about 125 CEOs of major corporate interests here in the metro area. Thank you for having me.
And Ted Maxwell.
Good morning, Senator-elect Kelly. Appreciate being invited to be part of this conversation. I'm currently the president and CEO of the Southern Arizona Leadership Council, the CEO consortium down south in the Tucson region. But today, I think I'll probably be talking more in one of my prior roles as the commander of the Arizona Air National Guard. I retired in 2018 as a major general from that position, and the Guard had played a big role in addressing COVID, and I'm look forward to sharing some of the success that they've had.
And Luis.
Thank you, Senator-elect. Luis Heredia, Executive Director for the Arizona Education Association, representing 20,000 educators throughout the state, teachers and parents and students that are facing uncertainty because of the lack of leadership, uncertainty on the application of what the definition of safety in not only in the environment, but primarily the type of equipment that teachers are testing. There is just not enough certainty on how to combat this virus and how to combat this public health crisis. So our schools are in desperate need of leadership. Thank you, Senator, for having this conversation.
And then finally, Tom.
Thank you, Senator-elect. Tom Belshey. I'm the Executive Director of the League of Arizona Cities and Towns. We are very pleased to be invited to be a part of this today. Our the small role that we played was in helping cities and towns work with the federal government as well as the state government in their response to COVID-19. We facilitate and try to get the resources to the right spot, provide policy help, things that will work well for cities and towns. Cities and towns at their heart are service delivery entities, and we just want to help. And that's what we've been trying to do. And we look forward to the public health response as well as other types of responses, economic development and other things. And so just very glad to be a part of this today.
Well, thank you. Well, thank you, everybody. Thank you again for joining, and for the folks that are here joining us for this discussion. I get a lot of my data on COVID-19 from the Arizona Department of Health Services, the dashboard I look at rather frequently, and just see what the trend is. But I think a good way to maybe start this conversation is to go to Dr. Gerald. And can you give us a little bit of a report about where our state stands right now in dealing with COVID-19?
Yes, thank you, Senator. And so unfortunately, I have no good news. Conditions continue to deteriorate in Arizona, and doing so for the past 4 to 6 weeks. As we look forward to our holiday season between Thanksgiving and New Year's, it's going to be a very difficult time in Arizona because of the burden of coronavirus. And so thinking through some of the specific metrics what we're dealing with, if we think about the number of new cases that are being diagnosed each day, we are now exceeding 2,500 cases daily. That's a pretty big number. We haven't seen numbers like these since the last outbreak in June, and that number is expected to rise over the coming weeks. The test positivity giving us an idea of how much the match is between the available testing capacity and the number of people who need tested. The test positivity is now exceeding 15%. And again, it's one of the highest levels that we've seen since June. Of course, cases matter because of the consequences that they bring to our hospitals and for COVID-19 mortality. And so when we think about how strained our hospitals are, they're in a really difficult position right now. Hospital occupancy is at an all-time high. We are at 90% essentially for both our floor beds as well as our ICUs. And so those are levels that we literally have not seen since hospitals instituted crisis care standards back in mid-June. And these conditions, again, are expected to deteriorate. When we think about the number of individuals who are dying from COVID-19, this is a lagging indicator. The number of deaths that are recorded represent what was occurring 3 to 4 weeks ago in Arizona. We have just now passed 100 deaths per week threshold. and are marching towards 200 deaths per week. There is a small glimmer of hope in that COVID-19 mortality has been declining over time by about 10% per month. And so we can in Arizona tolerate a larger number of cases and expect a fewer number of deaths than if this outbreak had occurred in June. There is a little bit of good news, but it's still a fair distance on the horizon. And so we have seen promising results from 2 vaccine trials that suggest over 95% efficacy. However, there's going to be real difficulty in ensuring that the individuals who need vaccination get the vaccination that they need. There's going to be incredible difficulty distributing these vaccines. And so it's going to be very important that we invest and ramp up the infrastructure to do that as quickly as possible. But it also should force us to rethink how we manage COVID-19 moving forward. And it provides even greater incentive to ensure that we have the right policies in place to minimize the number of infections that we have through the holiday season. Because every infection that we can prevent is potentially an infection we can prevent forever once the vaccine gets here, if the news is as positive as it seems. And so we need to be more vigilant than ever, because the deaths that could occur between now and when the vaccine is readily available are potentially entirely avoidable. And so I hope that we can double down on these efforts to gain control of this virus. Right now, though, it's not looking good. Thank you, Senator.
Well, thank you. Anne Marie, Dr. Gerald mentioned something that, caught my attention here, and that is we've had decreasing mortality as the weeks have gone on, but it seems to me that as we start to max out our ICU bed capacity and hospitals get stressed, that could turn around and go in the other direction, because if we can't treat people with with intensive care, we could wind up with a higher mortality rate. So I think we know this is going to be a difficult time for patients and folks who contract the virus, but it's also going to be a difficult time for hospitals as they reach capacity. So from what you're hearing, what are the biggest challenges that hospitals are facing right now?
Yeah, the biggest challenges that we're hearing from hospitals statewide really center around 3 things. It's number one, staffing. The staffing shortages that we have in Arizona that we were able to combat in the summer to be able to recruit nationally to get clinicians in to fill those shortages and those gaps. Second is PPE. We're seeing this had kind of cured up a little bit over the past 6 months, but now we're seeing shortages of crucial supplies like masks, gloves, various assortments of PPE. So that is becoming an issue again. And just the overall, and this ties back to staffing, but the overall strain and fatigue on our healthcare workers. This has been a really long haul for these frontline workers. And if the staffing shortages continue, it just becomes a critical issue. Those ICU nurses, those physicians, they need to take PTO, a number of days off. And we need to make sure that we have adequate staff, that those clinicians can get a rest. So those are really the 3 issues: staffing, PPE, and then just the constant strain on the healthcare workforce. You opened this with it. Oh, sorry. You opened this.
Is there a contingency plan if we can't find this staffing from other states? Because as other states have rising infection rates, the excess staff is not going to be available. So is there a contingency plan out there?
Well, I know that we were very pleased with Governor Ducey's announcement yesterday that he's going to provide some funding to hospitals to be able to recruit some healthcare workers to fill those gaps and to be able to do, I think, a statewide contract like we did over the summer. But what we saw over the summer and that we're concerned about now, and that there might be a federal solution here to put on perhaps your agenda, But what we saw in the summer is that there's price gouging when it comes to these traveling, these staffing companies. What was $50 an hour becomes $150 an hour when supply is so short. And so what we don't want to do is pass an Arizona price gouging, anti-price gouging measure. We want to do a national one, a federal price gouging number, because that would simply just drive, the supply outside of Arizona. So we do think that that's an important issue that perhaps could be on the federal agenda, so that hospitals can have a level playing field in terms of being able to recruit these travelers, and that they're not exploiting our vulnerabilities here. But
yeah, I heard that back in even back in July, that was already occurring with rising prices for no reason other than increased demand.
Mhm.
And when there's not a crisis, that's becomes a supply and demand. It's
Sure.
economics, but in the middle of a crisis, it's not acceptable.
No, not during a public health emergency. You really open this up with a gratitude, a thanks to the healthcare workers out there. And I think the best thing we can all do to express that gratitude is to do our public health measures, wearing masks, social distancing, and then as we head into the holidays, not have these small family gatherings is the source of a lot of spread, so that everybody takes our public health guidance to heart as we head into Thanksgiving and the holidays.
Mhm. Well, thank you. Hey, Mayor Evans. So, can you tell us a little bit about the top issues for municipal governments right now with regards to COVID-19, and in what areas is there not enough assistance available? Because we hear that a lot, that there needs to be help from the federal government for cities and towns. What are those specific areas where the assistance is needed?
So as a mayor of a city, I cannot stress enough that Arizona cities and towns, we need help. We have been in a constant state of chaos since March, and we lack the resources we need to address the issues that we are experiencing because of COVID at a local level. Very specifically, we need our federal and state leaders to provide us with a clear, understandable COVID-19 strategy. What are we doing to address the issue? And it needs to be articulated in a way that the majority of us as individuals can understand it, can understand what our role is, and understand exactly what we need to be doing to stop the spread and to eliminate it. Cities and towns need to have direct funding to address the issues that we are experiencing. All cities and towns. Here in the state of Arizona, we did receive as a state CARES Act funding, but only 5 municipalities got direct funding. By the time the funding trickled through from the state to the smaller cities and towns, not only was it greatly diminished, but there are also restrictions put on it, so we cannot use it to address the real issues that we see. We need expedited financial support for our small businesses, and that support needs to include the entertainment venues that were not covered under the previous act. Our county health departments need to be 100% reimbursed for COVID-19 expenses. There's currently major issues with them getting reimbursed by FEMA. The issue of unemployment needs to be addressed. You mentioned, Senator-elect, that it's currently $240 a week here in the state of Arizona. Something else I think is important for us to understand is that the majority of people who are receiving some type of unemployment, that unemployment is going to end December 15th. And so that needs to be addressed. Additionally, we need housing assistance, not only for renters, but for property owners who have mortgages on their property. That is a group that has not been assisted, and there's been no thought to how those individuals can allow people to stay while we're working through this issue, but also be able to maintain their property. We need a jobs bill. A lot of the people who have been displaced by COVID, those jobs are never coming back. We need to acknowledge that, and we need to start working now on how to get those individuals retrained. And lastly, we need broadband. It is a major issue here in rural Arizona, parts of rural Arizona. It's not the fact that people cannot necessarily afford internet. It's the fact that there's no cable for internet. That ties into jobs, that ties into school, and that ties into business. Thank you.
Yeah, and it affects so many things. You say schools, but businesses, but also healthcare. And the health of a population is directly related to access to broadband, because it's the ability, especially now when we're implementing telehealth policies. It affects a community in so many ways. Neil, I want to go to you for a second. When I was up in DC last week, there was a lot of discussion about small businesses, especially, and concern that if there isn't a COVID relief package here sooner rather than later, if it has to wait till January after a new administration is sworn in, or February or beyond, that we're looking at the potential of a rather large percentage of small businesses that could fail. So can you tell us a little bit more about what you're hearing from business leaders out there as to what are their short and some long-term challenges that they're facing?
Right. Great question, Senator-elect. And there really are different categories, and there's no one answer to this. Most of our major employers in the metropolitan Phoenix region, which comprises about 73% of Arizona's economy, are not bringing their employees back in until April, May, or June. That's a different situation than you have with the small businesses. And the information you're hearing is exactly right. The Paycheck Protection Program provided a lifeline and a lifeboat for a period of time. The air is going out of that lifeboat. And as the air goes out of that lifeboat, a lot of those small businesses will not be able to keep going. It's not so much a paycheck protection program, it's a jobs program. And the focus needs to be on how do we maintain those jobs in addition to just adding to the paycheck for the long term, to sustain those jobs over a long period of time. Quite honestly, that needs a bipartisan solution. There just hasn't been able to be agreement on that. So that's something that will be really important to work on. The other aspect that's important, and the one thing we know, is that there is no one area that's being hit. Everyone is being hit pretty much. But you look at the economy, especially here in the Phoenix metro region, just take the tourism industry alone, down by close to 65 to 70%, thousands of employees who can't be called back. And this shows the interrelationship of all of this. They can't be called back because it's all related to consumer confidence. If consumer confidence doesn't come back, then people are not going to be going out and going to different businesses. So how does consumer confidence comes back? Consumer confidence comes back when we're following the issues that have to be dealt with regard to health safety and health practices, which are then connected also back to just sort of the overall messaging. And one of the speakers mentioned earlier, the overall uncertainty with regard to messaging and what people are hearing. People will hear what they want to hear. And quite honestly, right now, whatever you want to hear, someone is probably saying it. So we need to help in the business community. We're trying to help first through our employees, of course, then to consumers, and then broader out to suppliers and the larger ecosystem to spread the messages of safety, best practices, health practices. You mentioned the health industry and Banner Health and others. Our CEO consortium of all just the healthcare providers and insurance folks are meeting on a regular basis, trying to see what they do to help get the messages out that may not be delivered by other people. And then just two major things. The issue of business liability is going to have to be dealt with, and whenever the second or third rounds come around, it's a huge issue with regard to liability. And then in our region here, and I'm sure throughout the rest of the state of Arizona, that December moratorium on evictions is coming up. And what are we going to do about that? What is going to happen when people are not able to pay their rent and their landlords then can't pay their mortgages on their multi-unit complex and so forth? It's just all interconnected. And I think helping people understand the interconnection of all of this is a good reminder for people that we all have to do our part.
Yeah, it's a cascading series of events that puts us in an eviction crisis and homelessness, and also then families that have to move in with relatives and more folks under a single roof, and then rising infection rates, and it just builds on itself. We've got 550,000 small businesses in the state of Arizona, and we have to make sure that those they survive. I mean, some will not. Many have closed already for good permanently. But the ones that remain, we've got to support them. And I struggle with what I see coming out of Washington is often, even during a crisis, folks are that serve in Congress are often worried about who might get the credit for something. So instead of acting, they delay. And it's critical in a crisis to try to get it right, but try to do it soon. And we can worry about who's going to get credit for the success or the blame later. That's very frustrating for me, and it's something I'm going to bring up with my colleagues on both sides of the aisle once I get sworn in. I want to go to General Maxwell for a second here. Early on, and I imagine this is continuing, especially with rising infection rates, the U.S. military has played a role, whether it's in New York or the state of Washington with field hospitals, the USNS Comfort or Mercy, I can't remember which hospital ship, but there has been a role for the U.S. military. Can you describe a little bit what that role has been for the military in battling this crisis here in Arizona? And what are some of the biggest challenges that you've seen on that front?
Senator, a great opportunity. I'd love to share some of the successes. As you know, being a military member, the military will get the job done. And I think when it comes to defense of our country, there's still missions going on that people need to be aware of, protecting our borders, protecting our air defense. But what's missed quite often is the role we play when there is a crisis, and the role that the military plays, and specifically the National Guard. In the state of Arizona, Major General Mick McGuire is the Adjutant General. And as such, he's not only the commanding general for both the Army and the Air National Guard, but he's also the director of the Department of Emergency and Military Affairs. Only about a third of the states structure their emergency response that way. And under General McGuire's leadership, the Guard has played a significant role in trying to address some of the issues. The big roles where the military plays is logistics, medical, and then there's some air support, especially to some of the remote areas of the state of Arizona to help deliver goods and services. There's currently about 700 guardsmen who are normally part-time military members who are now on full-time orders through the end of the year. That number's been as high as 900. They've spent over 300,000 man hours. They've delivered over 800,000 tons of food and over 8 million pieces of PPE. But it doesn't just stop at the delivery. On the logistics side, it's not only the truck drivers and the logistics personnel who, men and women who are getting the goods to where they need to go. They're going the next step. They've been stocking the shelves. They've been helping to distribute, and they've been ensuring that access to quite often scarce resources is available, not only in some of the large cities, but really they focus on the gaps and getting out to the nations and to the rural communities that may not have as much access to it. And that's true on the medical side as well. It's significant to note that many of the members of the 8,500 members of the Arizona Army and Air National Guard are also first responders and medical personnel in their full-time jobs. So they've trained to do these kind of roles. And on the medical front, they've done everything from stand-up test sites, quite often conducting the testing themselves. Again, particularly in those gap areas where they don't have, they've looked and explored the opportunities of land, locations, and facilities that they could stand up if the hospitals do get overrun. And that's a backup. But they spend a lot of time training folks in nursing homes, in assisted living homes, training folks on some of the nations, as well as in the rural communities, on not only the proper use of PPE, the proper administration of some of the tests. Currently, they're transitioning to the new rapid tests that are going to be able to be used in some of these facilities. But they're out there every day. Mm-hmm. And in a situation where we've got a lot of the people that do a lot of good things for our community in volunteer status, a lot of those folks are retirees. They're people who are at risk of this virus, so they're not there. But the call up and the activation of the Guard at a state level to do support for this kind of pandemic has been significant. Over 38 food banks have been actually had guardsmen in their distribution lines helping get the food to those who are in need. And you talked a little bit about what their challenges are. First off, I'll tell you the morale inside those who are called up is as high as it's ever been. This is what they train to do. This is what they want to do, whether it's in the medical front or in the logistics front. They're out there and they're doing good. So morale is high. Recruitment actually is high right now because people are seeing the presence of these folks out amongst the community. And they've done a very good job on keeping infection rates in the forces low. It's less than 3% in the forces. And so they continue to worry. My concern, and this is my concern, is, as I said, they're on orders till the end of December. We're far from having the solutions in place. There's going to be a role for the Guard and the military in distribution of the vaccines and transportation and administration. There's a lot more to come, and it's not all going to stop December 31st. We won't be there yet. So if there's anything, Senator, I think you could focus on when you go back and you're sworn in is ensuring that the support that's required for those military folks and the continuation of orders will be there, because I think the role they're going to play until we get this under control, we get the vaccine in place, will continue to be significant.
Well, thank you, General. I want to move to Luis, talk about schools for a second here. And parents that I've spoken to across the state are really struggling. Children are stressed out. Teachers, it's a horrible situation, to be honest. And safely reopening schools has been a big challenge. Can you share with us your thoughts about on what that has looked like in Arizona? What are the major challenges that schools and teachers and students and parents are facing? And what do we need to be doing to make sure that students and teachers are safe at this point?
Thank you, Senator-elect. And I first have to say, every teacher wants to be in the classroom interacting with children that love to learn. I mean, that they yearn, this is a stressing point for them, not being in that environment that they have committed themselves to a profession. The reality is that they just need to be safe in an environment that the community outside and the government that should be protecting people are putting clear guidelines to ensure that that environment and that safe learning environment is more guaranteed. You can't guarantee everything, but you have to have some consistency. We have been asking for a statewide mask mandate because it is necessary. Clarification in the schools. This becomes a debate among volunteer school board members having to decide public health decisions in 223 school districts throughout the state, and each of them have different pressures, and that is not the right environment to create a learning, sustainable, and an ability for our students to achieve in what is already a very difficult situation. We are having staffing crisis as well, teachers leaving the profession. We have a shortage of substitute teachers that is only adding to the stress of teachers not being able to accommodate certain issues that are happening in their family, accommodations that they need to meet. We are seeing stress and the reality of the need for mental health concerns to be addressed as well in this environment. But I think what we are really advocating for is that there needs to be some clear definition of leadership, and as simple as just clarifying the mask mandate. And there has been guidelines out of the State Department of Health Services, but it is still being interpreted because they're just guidelines. And parents and teachers and administrators are all struggling with these scenarios. We have incidents of just the support levels. If you are on a completely online platform, the task of just taking attendance is an all-day event of students popping in or the scenarios. I mean, those things have created stress. If you are in a hybrid or in-person instruction, I have my son who is 15 years old, and his friend, he's an online platform right now at Chandler Public Schools, but his friends say that they feel like prisoners in every movement and in the way that they have to kind of accommodate, and the teachers are feeling stressed in that environment. They don't have enough resources to support just the crisis that we're currently in, and just being honest to ourselves that we are in a crisis that requires additional support, either in resources for teachers to hire more instructional aides or other folks, but we're having a crisis in hirings. But we just got to focus that we have a plan that is statewide, not just the guidelines and asking pretty please in a lot of things. Our teachers, like I started off this statement, they want to return back to the classroom to do the job that they love. It is imperative for our economy because the operations of schools are connected to the jobs and sustaining our economy. But there's also needs to be some leadership, and we feel that as we talk to educators every single day, they feel that they are extremely tired. It was in September that statements came back saying that they felt they were already like in the May end of the school year, just of pure exhaustion. So, Senator, I think if I could say is that any federal funding or guidelines that is directed to school district require the states to have much clearer procedures to protect schools, to have guidelines on the opening of schools when you have when community spread is reduced and there is enough testing available when you have those scenarios. That is a clear. Another big issue is just the notification. We do have a public health with the county health department, the school districts interacting. We are reacting in a 7-day lag or a 14-day lag of information, and that causes a lot of stress to the parents that react immediately in the school site. So we need to identify the gaps that we have in this notification when there is an outbreak.
Yeah, I think, under pre-pandemic, scenarios, being a teacher it's a tough job, tough profession under ideal circumstances. And now what teachers are dealing with is it's got to be incredibly stressful and challenging. And the education of our children is so important because it's really so critical to the future success of our state. So yes, as I will, when I get back to DC here in December and get sworn in, it'll be a focus. And finally, I want to go to Tom Belshie. So Tom, Mayor Evans spoke a little bit about Arizona cities and towns and the need for assistance during this crisis. How do you see that? Like, has the demand for assistance been met in those areas she has mentioned? And if it has not, what starts to what do cities and towns do if they don't have the resources for essential services? I mean, what then starts to get cut?
The most important thing to us, and I was happy to have the mayor steal most of my thunder. She expressed very well the things that we're concerned about. But I think there are 3 areas for us. First and foremost, our big role in this is always public safety. We're on the front lines with our police, our fire, but also some things that people don't think about a lot, like water and sewer. And those workers that are there, one of the things that we deal with a lot is having enough cleaning supplies, having enough of the types of things that clean our water. All of those things are extremely important. And when you talk in 91 cities and towns in Arizona, they all have very different characteristics. Some of them are struggling more because they're more dependent on the tourism. Some of them are not struggling as much because maybe their economy is more diversified, but their small businesses are struggling. Their renters are struggling. And one of the things that I think that we've done very well is we are nimble. We are the form of government closest to the people. And we've had some great programs. I just wanted to mention, for example, a very successful program that the city of Phoenix offered, and that is eviction mitigation. And they took $20 million that they received as part of their direct flexible funding, and they put it to work. And in a month, they got $20 million out into the community to help those renters who wouldn't be able to make their payments. And that in turn helps, the multi-housing association and all of their folks that work with renters. And, I just think that we would like to see more direct, flexible funding in order so that we can make sure that our public safety people have the PPE they need, that our public works folks have the cleaning supplies, all the things that they need to function, because a large part of the economy happens in our 91 cities. The other thing that I'd like to talk about is for those cities and towns who are going into their reserves, who are continuing to offer, we're not saying that we're in a crisis, but it depends by the city. So direct flexible funding, what it allows us to do is those cities who need that money to do budget replacement will have it. But those that receive it can also help small businesses. And another large part of what I think that we need to talk about as well is infrastructure development. We mentioned broadband. That's a really important thing. Also, road maintenance. The great thing about infrastructure development is it has, two effects. One, we can always point to whenever we're trying to kick off a recovery in our economy, it normally starts with infrastructure development. And so that's the kind of thing, again, that cities and towns specialize in, and they want to play that role. And most people don't know this, but those are jobs that are not done by city personnel. Those are done by contracts with the private sector. And so it's a way that we manage the contracts and get and pump money into the private sector. And whenever we beef up our broadband, our transportation resources, that always has a positive effect on the economy. So I just think that, like the mayor said, you give us the resources and we are nimble, we'll get it to the places that it needs to go. And we have had very successful programs. The last thing that I wanted to mention is we've had a very successful program. We're working with the restaurants throughout the state. And one of the things that they're doing now is they've had the ability to open up for in-house dining safely with distancing, but they've had to cut out a lot of capacity for diners. And so we've helped them with something called extension of premises. And that's a program that the league helped facilitate, and it's helping restaurants across the state be able to access, some public right of way in order to safely distance their patrons so that they can, offer in-house dining to them. So again, what I would just say is that the experience of the 91 cities is different. Some need more fiscal help than others, but we want to play a role in helping the economic development that's going to bring back those small businesses, help those that are already there, and help to develop new ones where we can employ those people that have lost their jobs. And so we stand ready to help out and look forward to another package where we can continue our good work and get people back to work and protect people during this public health crisis.
Yeah, I mean, so many critical issues. It's I don't think any of us anticipated being in this situation, a year ago, and now we're here, and it affects so many sectors and so many parts of society. You're right on the infrastructure bill. I mean, it's a way to put people to work. It's economic stimulus. You also get something out of it in improved roads and bridges and broadband, which, Mayor Evans pointed out is needed in rural areas. I mean, so critical to the health and the success and the economy of rural Arizona. General Maxwell, I will certainly look into this after I'm sworn in. The help from the U.S. military has been sort of unprecedented here during this crisis, and we need to make sure that Guard and Reserve units have the resources they need, but also that hospitals do that are really struggling, and schools and small businesses. This is not going to just end here when we start to deploy a vaccine. I mean, some of these issues are going to last for a while, and it's going to take a bipartisan effort in the United States Congress to try to come up with solutions to bring us out the other end of this, stronger. I've been, campaigning basically for the last 21 months or so, but now I'm ready to get to work in DC and do what I can to help get this public health and economic crisis under control. I'll be seated in the U.S. Senate, I think the first week of December, and I've already started reaching out to my colleagues on both sides of the aisle and talking about some of these issues. that affect Arizona and our country. So thank you for joining today. This has been really valuable to me, whether I have it, Gladys here has made some notes for me. I'm sure like price gouging of contract nursing is on the list, and guard and reserve funding and everything we discussed today. So thank you for joining. Stay safe, everybody. For folks that are watching, please wear the mask. It works. Socially distant. We got Thanksgiving coming up next week. We don't want to be crowded into small spaces indoors. That'll spread this infection. And wash your hands and promote that with your friends and family. And if we do that, we can, again, flatten this curve. We know it works because we did this in July, and we can do it again. Thank you, everybody. Thank you.